Hello, I'd like to thank the committee on behalf of my team and myself for the opportunity to present our research titled Factors Contributing to Success and Career Progression for Women in Academic Medicine, a Qualitative Study. The glass ceiling is a concept in medicine characterized by lower pay, fewer career advancement opportunities, and fewer tenured faculty positions held by women physicians across the nation, despite increasing numbers of women entering medicine. A study published in the New England Journal of Medicine demonstrates this increasing trend of women entering medical school, and yet the number of women in leadership positions in academic medicine has remained largely stagnant. The purpose of this qualitative study is to evaluate positive factors, obstacles, and characteristics that individuals reflectively identify as contributory to their current positions of leadership within academic medicine. Focus groups were conducted with University of Utah women students and faculty holding positions of leadership. Questions for the semi-structured focus groups were reviewed independently by 3 separate investigators to minimize leading questions and maximize the themes that could arise. Focus groups interviews were conducted until there was a saturation of themes. Transcripts from each focus group were coded and analyzed using the thematic analysis method. 3 faculty and 3 student groups completed a focus group interview, with a total of 25 individuals consisting of 10 students and 15 faculty. Leadership positions were determined in the academic setting as assistant professor, associate professor, and full professor. Leadership roles included executive medical director, program director, mentor, career coach, academic senate, committee member, course director, assistant and associate dean, vice chair, CEO, vice president, and division chief. Mentorship and sponsorship were the most frequently identified positive factors leading to success. Mentor relationships were more positive when there was a diversity in the level of the training of the mentors, diversity in the location of the training of the mentors, and a diversity in the race and gender of the mentors. Sponsorship was frequently identified, but infrequently defined. In the few definitions that were provided by participants, they described sponsorship as a relationship in which an individual is an advocate, usually as a senior level individual, who gives opportunities to a junior individual. Additional positive factors identified included leadership training programs such as the Executive Leadership in Academic Medicine, also known as ELAM, a strong support system outside of medicine, and allyship and advocacy by men. Obstacles to success were varied, with the highest focus being on discrimination, microaggressions, and sexual harassment. Participants gave examples of experiences depicting these obstacles, which included women berating other women, sexist comments, lack of institutional support, perceived lack of respect for their role, and a perceived lack of respect for their authority. Individuals also reported incidences of sexual advances and sexual harassment, which was traumatizing to report. Many women also identified intrinsic qualities which were barriers to advancement. Imposter syndrome was a common topic of discussion, as well as perfectionism, undervaluing potential, and a lack of aspiration for leadership. Perseverating on prior failed attempts likewise was a barrier to several individuals. A lack of positive role models or presence of poor role models hindered the progression of some participants' careers. Lack of family support was also frequently stated as a barrier to progression. When participants were questioned regarding the attributes that make good leaders, the most frequent answer was the ability to self-reflect and maintain a growth mindset. This, coupled with confidence, enabled women to remain resilient despite failures or setbacks. Tangible skills that were identified included skills such as becoming an educator or an effective communicator, as well as understanding the financial aspects of the business of medicine. These individuals also identified suggestions for women who are looking to hold a leadership position within academic medicine. Women advocacy was identified as a way to have women teach women and help and address hard topics with transparency, support other women, and learn from other women's experiences. Being competent in a network building was the other primary suggestion that participants responded. As a qualitative study, there are obvious limitations to the conclusions that can be drawn from the study. However, a number of positive factors were identified as already functioning pieces of institutional systems, particularly that of leadership training programs. Areas for structural improvement at the University of Utah are improving the availability of mentors and role models and a no-tolerance policy for discrimination and gender bias. like to thank you again for the opportunity to present our research, and please feel free to reach out with any questions. I believe that my email has been provided. Thank you.